Hi, everybody. It's Dr. Roth. Welcome to Topic 8 in Developmental Language Disorders. So this week, or this topic, we were going to go over evaluating principles of evidence-based practices, evaluating culturally, linguistically diverse practices, and analyzing potential intervention approaches for different scenarios. We were supposed to read chapter 3, 12, and 14. So I thought that we would just kind of start off doing a little summary of that and then reviewing kind of just like standard language interventions that you would kind of see in that school age population. So for chapter 13, we the general objectives for that chapter were to identify the purposes of intervention, discuss principles of evidence-based practice, discuss ways of identifying appropriate goals for communication intervention, describing classifications of interventions at various points on the spectrum of naturalness and explicitness, list and discuss various contexts for providing intervention, describe method of evaluating treatment outcomes, and outlining the SLP's role for the three levels of prevention of communication disorders. So we'll just go through each one of those one by one, and we'll do the same with chapter 12 and 14. So, the purpose of intervention, I'm sure a lot of you guys know this, but it's to either change or improve communication by enhancing the child's language ability. So, we might teach like compensatory strategies or modify the environment to support communication. It might also look like focusing on preventing future difficulties through, strengthening areas of weakness, providing coping skills, and also improving functional participation in daily life, especially for those students that are more severe or more complex. Um, so, basic principles of evidence based practices. This is going to be obviously using research based approaches or research and evidence based approaches. But then we also need that clinical expertise, which is what we're developing in school and grad school. And then, of course, you'll get much more of this in the field in your clinical experiences. That's going to be your kind of clinical decision making when you can make those judgments in the situation. And then finally, client values, preferences, and family priorities. So, this is a big one because if you design an intervention that is not socially valid, doesn't work for the client's interest, doesn't work for something that the families or even maybe teachers will uphold and practice, it's not really going to be relevant. We're not going to see that carryover. Um, so it is a big part of our decision making. So again, research-based practice, clinical expertise, and client values and preferences. We are going to, the next one is identifying appropriate intervention goals. So this is where, we're going to use all the assessment that we've been talking about previously. We're going to use our standardized assessment, our languages samples, our, questionnaires that we've done with the teachers and the parents. And we're going to design those explicit goals of what we're going to target. We'll talk about that a little bit later, but this is like our kind of SMART goals where things are, observable, measurable. We can collect data on the goals. The goals are going to make meaningful change. Um, so, goals are chosen by examining the child's current communication abilities. Also, we want to look at their developmental expectations. Are they where they should be? And if they aren't, like, how delayed are they? And we're going to prioritize maybe things that are um, either more relevant to what they're currently working on in the curriculum at the time, or of the greatest impairment to their academic skills, their communication skills, or things that are greatly delayed. So maybe more minor things like, yes, they got flagged on their evaluation. We can embed them into our interventions, but are we going to get a lot of bang for our buck when we're writing our maybe like our 4 IEP goals, right? So those are all considerations when we're choosing goals. We're going to use our data from our assessment, caregiver input, and then research about the typically development sequences guide goal selections. So this is why in a lot of your assignments you're seeing, basically all of our assignments, we have a huge emphasis on using evidence-based sources, using research articles, using your textbook, because anything we choose, we want to make sure it's research driven, developmental norm. We know it's going to make a statistically significant effect in the child's life. We're not just picking it because we notice it and it seems strange, right? We're making clinical, research based decisions. So, classifications of interventions along a spectrum of naturalness. So, I know we've just done a discussion board on this, but there's the different types of intervention that we can choose. We can do clinician directed. So, this is going to be your more highly structured, explicit teaching. This is more kind of like that lesson planning that you're doing, the seated work. Of course, you can do this in individual or small group. But this is going to be that it's kind of more of that didactic, like one-on-one SLP instruction, repeated practice with the student, maybe probably at a table. Then there's the hybrid approaches. So this is your mixed structure. So we might still be at that table doing games. Um, and it is kind of like lightly structured. You have your goals in mind. You've created an activity. This is probably when you're using your board games, to target different like language goals. But it is mixed in with naturalness opportunities. So, for example, like if you have a group of three, this is where, you're taking your turns around the board games, you're working on your conjunctions, for example, and then maybe a student tells a funny story or, a joke of all, involving what you guys are targeting. Then you stop and you talk about it and you allow a little give and take. It's a little bit more natural, the hybrid approach. And then the child centered. So this is when it's highly naturalistic. You're following the child's lead. And then of course, what you select depends on the child's needs and target skills. So I mean, we can almost there's always ways to do child centered. But when I think of using child centered, like really follow that high following the child's lead intervention, it's gonna be I think of using that more kind of like with our younger kids or with our kids with autism, nonverbal, minimally verbal. This is when you're kind of maybe on the playground, kind of shadowing the child with autism or severe language impairment, and you're modeling when they're climbing on, the monkey bars. You're saying, "Oh, you're going up, 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 up." Say up, 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 and you make it really like play-based, child-led, but you're constantly interjecting those language opportunities. You might be on the floor playing with toys and creating those temptation, communication temptation opportunities, where maybe the child is, highly interested in cars. So you take the car and you hide it and you say, "What? Where is it? Where did it go?" And you just make it, those naturalistic interventions, and have, try to prompt them to say car, or maybe they're rolling the car and you're narrating it. Um, but you're following the child's lead. So I think there's definitely room for all three of these. It's really dependent on what you're working on. So, if you're working on more of those academic goals, the clinician directed, you might want to start with that and then follow it up with like kind of the hybrid approach where it's more of that kind of like interactive play based, but still very much like, structured practice, table work. And then, of course, like I said, with the child centered approach, it's going to be for, either your more severe kids, or maybe you can even do a booster session with your higher kids and have it be child centered and kind of generalize those language skills into the school environment. Okay, context for providing intervention. These are things that we know. I know a lot of you guys are in these settings, but of course, there's like, clinics, schools, homes, community environment. And then, of course, there is the individual and group. And then, with our kids who are kind of just on that kind of tail end of therapy, you can do that kind of like you're in that kind of consultation mode where you kind of just do check ins with them. Um, okay, methods of evaluating treatment approaches. So this is where we want that data. We have a general sense, but a lot of times the data can identify and highlight more minute trends that might not be as observable to the naked eye. So collecting data, check marks, tally marks, just something really simple and functional during therapy. And of course, most of the time it's basically always required by either insurance or IEP information. But it doesn't need to be complex. If for your session, you pick your 3 or 4 target goals. I'm working on pronouns, I'm working on prepositions, I'm working on conjunctions. And then you target, you know, dash, 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 minus for when they get it wrong, dashes for when they get it right. Just make it really simple on yourself because we do want that data. So whatever you choose, it needs to be functional and usable. It needs to um, not impede your ability to teach or have meaningful interactions with the students, but we do still need that data. Um, and it's good. I think it's good for the therapist to use this too, other than just requirements, because a lot of times, as many of you know, I know a lot of you are already kind of working with some kids. Gains can be really slow or minor, but that doesn't mean that they're not important. So I think it can also be really reinforcing to the therapist to see, even though progress may be slow, we are seeing that improvement. And then when we have our check-ins with the parents, they love seeing that gradual improvement, any improvement. It just makes them feel good. And you can even bring the kids in on this and just show them, like, we've been working for so many weeks, and like, look, like, you used to not really notice these words and sentences. Look how many times you noticed it this week. Like, I'm so proud of you. So there's a lot of ways beyond just, the requirements of data, that it can be used to, like, increase engagement, encouragement, positivity. So data's good. Okay, so the SLP role, and the 3 levels of prevention. um, so this is a little bit more generally talking about what we're talking about. We talked about like MTSS, the 3 levels of intervention, or like the RTI model, which I don't know if you guys remember seeing. That's like a triangle where it's like level 1, level 2, level 3. But they're all kind of that same thing. And this is a kind of a more general conversation on that topic. So primary, so like level 1, universal. That's kind of when we're just doing that across the board ground level primary prevention, like we're promoting healthy communication skills in our school environment. Maybe we are doing little visits to the different classrooms and giving teachers like general best practices approach for that whole group setting. Like maybe saying like a whole group intervention might be have the teacher write the instructions on the board instead of just saying it verbally. Like that could be like a tier 1 or a primary prevention technique. Um, Secondary prevention, that can be your early identification and intervention of problems. This is when you kind of maybe you're kind of pulling like that small group setting. They're not quite in like intensive intervention yet or full blown SLP therapy yet. But there's some kids that might have some like literacy skills. They're a little delayed compared to their class, and you might just kind of pop in and do some of these. And I don't want to call them booster because they're not booster. Normally means you've already begun therapy, but I don't know, just little supplemental small group interventions to see if you can kind of boost those literacy skills with these like 3 or 4 kids that just might be a little delayed, and you want to kind of see how they respond to intervention. Maybe that's all they need. Maybe they're done after that. They just needed to be caught up. And then and then the last one is providing treatment to limit the impact of established disorders and improve in functioning. So this is that tertiary prevention. They do have the disorder. Now we're doing like the interventions therapy. We're targeting specific areas of deficit that have been like formally identified. And we're trying to both strengthen those areas, cognitively, linguistically, but maybe also providing coping skills to help the students like identify, oh, this is an activity where I normally have trouble with my, listening skills. I'm going to use my like note taking, techniques that I've learned, or I'm going to buddy up with my peer that my teacher gave me because I know that this is something that I normally need a little extra help with. Okay, so that's chapter 3. Kind of breezing through these because we have a lot of information to get through. So chapter 12. Again, I'll just kind of go over the objectives for the chapter. List the elements needed in a plan for language and communication intervention at the elementary school level. Name the required elements of a IEP, or an individual education plan. That's our kind of school-based plan. We're going to define and describe appropriate intervention goals at the elementary school level. We are going to list a variety of intervention activities at the elementary school level. We are going to describe the role of the SLP at each tier or multi-tiered system of support. That's that MTSS. We already talked about it a little bit, but we'll just touch back on it. Discuss the role of various intervention agents at the elementary school level and the ways in which they structure collaboration. So these are, our kind of team members that we're going to be working with. And then apply concepts discussed to the education of students with autism and intellectual disabilities in elementary school. So these are more complex kids that are going to have those language disorders. They're going to be more on the functional side, probably. I mean, for autism, depending on the level. Like if they're level 1, those are our language kids. But if they're level 3, which is the more severe, then they're going to be kind of more with our intellectually disabled kids. We're going to be working on that functional communication. So number 1, elements needed in a plan for language and communication intervention at the elementary school level. So, okay. So we need a plan for our language intervention. Our plan should include a description of the child's communication strengths and weaknesses. We always want that strengths and weaknesses model, especially when we're talking to parents. There is no such thing as a child who can't do anything. So I don't care how severe the kid is, we have to highlight the strengths and we have to use those strengths in our planning. So you might have a very, very verbally impaired child, but they always bring you things, bring you objects. Well, it's like, oh, well, the child initiates by bringing objects and, creating communication opportunities. Okay, that's a strength. We don't just have to focus on all the things that they can't do, like, oh, they can't talk, or they can't use words, or they can't, so it's a little bit of both. And we're going to use that strength to build the intervention on. So we want clear and measurable goals. We'll just touch on this a little bit, but I do think we're going to touch on it more later in the semester. These are our SMART goals. So anybody who is in the school or doing a little bit of SLPA work right now will recognize this term. But SMART stands for goals that are specific, measurable, achievable, relevant, and time-bound. So for specific, an example would be follow 2-step verbal directions. It's very specific. Measurable. They're going to do this with 80% accuracy. Now, all of a sudden, all of our little dashes and minuses are that's telling us where we're at. Are we 70%, 80%? We want them to be achievable. Progress can be tracked during structured activities. So, this is especially during our client-led approaches. We can definitely target this or track this, but even in our child-led approaches, I mean, for a target word while we're following a little, nonverbal 4-year around is to say the word car as many times as possible. That's very measurable. Like, how many times do you say car? Oh, and for that one, I actually said this on someone's discussion board. The child-centered, child-led, especially with our, little ones or nonverbal ones, a really fun hack for that is, I actually did this when I was in grad school. It worked really well, and I brought it with me into the field. You take like duct tape, or packing tape or whatever, and you tape it onto your pant leg. and you're following these kids around and you're crawling through the tunnels and you're climbing on the recess, but you have a little pen in your ear. And every time they say the word car, for example, you go on your little pant leg with your tape and you do a dash. And at the end, you just take off your tape, tally up all your dashes, and there's your data. So there is still even a way to get really easy ways to track data, even if you're kind of like on the move. Okay, so we talked about specific, measurable, achievable, relevant, improves comprehension and ability to complete classroom tasks. So again, we don't want to target, the child's ability to alphabetize office equipment if they are working on reading skills. Like, what is that going to do for them, right? What we want to do is if the kids are working on animals at the time, we want to use animals. We don't want to just use some like arbitrary list, right? Um, and time bound. So this is, especially when you're like in the school system, like by the end of the school year, you will be 80% accuracy by the end of the school year. So that's normally our like annual goal. And then you'll have your like objectives, which are kind of like your smaller goals that help you achieve your annual goal. And, the objective might be by the end of the first semester, or by the end of the first quarter, by the end of the second quarter, by the end of the third quarter, that kind of thing. So an example of a SMART goal. Here is, when you put all of those elements into place, here is what a good, well-written SMART goal might sound like. By the end of the school year, time bound, the student will formulate complex sentences using conjunctions. Example, and, but, because. So that's specific. In written assignments, it's also specific, with 80% accuracy, measurable, as measured by review of the student's classwork. So that's going to be irrelevant, and then all of these are achievable as well. Okay, so then, when we're doing our plan, we also want our interventions to be evidence-based. And that's very easy to come by these days, especially in our, internet world, but definitely make sure you're using relevant sources. I mean, at the very least, use ASHA if you're not using, research articles. But also there's a lot of programs out there that you might have access to if you kind of follow the program and kind of pick the sections that are targeting what you're working on. And also a lot of the evaluations will give you target areas. So the results of your evaluation might tell you like you need to target these areas, like they'll delineate that for you. Okay. We want to pick an appropriate service delivery model, the correct setting, frequency, group versus individual. What is the student going to benefit from? Strategies from curriculum-based supports. So we want to consider like what the student is doing in the classroom. We want to be relevant. And then maybe we can even use materials from the classroom so that there's carryover. And then for our methods for collecting data and monitoring progress, we want them to be like functional and usable, but accurate. And then plans for collaboration with teacher and caregiver. We've talked about this a lot, but this is going to help us with that generalization across settings, taking in social validity. Like if we're teaching something to the child that the parent or the teacher isn't going to care about or use, then they're not going to learn anything from it because they will never, ever, ever see that skill again. So we really want to kind of get like, what is the teacher seeing as the biggest challenge in the classroom? What are the parents seeing that is the biggest challenge in the home setting? And then factor that in when we're picking our goals, because if it's not only relevant to the students' challenges and deficits, but it's also relevant to their functioning in the home and the school setting, you're gonna have a lot of reinforcement when they use the good language attempts. You're going to have engaged adults being excited when they do it correctly, and they're going to notice that improvement. You might even see better peer interaction. So that's why that collaboration is so important. Okay. For required elements of an IEP, This is a bigger topic, so I'm just going to kind of just name it because it's really, this could be a talk in and of itself. But if you've ever worked in the school setting, you're going to kind of recognize some of these things. But just so that you've been exposed to it, an IEP must contain um, present levels of academic and functional performance. So, are they doing academically? And how are they doing actually in the classroom? How are they talking to their teacher? How are they talking to their peers? Um, we need annual goals. That's required in an IEP. And there's normally, you don't want to go nuts. You want to have like maybe like three or four kind of max. I don't think I've ever seen more than four goals in an IEP for any one section. So like SLPs, we would have four goals, but then math might have three goals, and then that kind of thing. um Specific services to be provided, so like what are we providing, the type of intervention, how often, duration. So this is where you're going to see group SLP sessions 2 times a week for 30 minutes, you know and typically, just so you know, like, we don't normally see more than 3 times a week in the school setting, and those would be for like really severe kids. um, you often see small group. Um, you might see individual, and that's really up to you. And that could be for any number of reasons. Like I had a stuttering child once, who was very smart. He was in first grade, but he had some pretty severe behavioral challenges, and he was also extremely self-conscious of his stuttering. And every time I tried to integrate him with the group, it just kind of turned into a train wreck. He wasn't learning anything. They weren't learning anything, and his stuttering was pretty severe. So he was somebody I just kept all the time, individual. So you can kind of make those like judgment decisions. But at the same time, group can be great too, because then you get the interplay of peer modeling, peer interaction. They can see how their language is affecting their social interaction in real time. So group can be really good as well. You just kind of have to make those judgments. Then accommodations and modifications. So these are more just like, how are we going to generally supplement the educational environment? Sometimes we're like a little limited in what we can do in this area, because it needs to be kind of like approved accommodations, but it could be something like, instructions are read aloud to the child, just kind of like things where their typical assignments are just slightly modified just to help them a little bit more. How progress will be measured and reported. So we're going to say we'll collect daily tallies of communication events throughout the day or something. But either way, you need to like delineate like whatever your school district approves as an appropriate data collection method. You need to specifically say how will you present the data, and then you need to do it because if it's written in the IEP, you're now held to that. So keep that in mind when you're choosing your data collection technique and how you will measure and report it. Participation details, or sorry, yeah, details for state and local assessment. So normally this is kind of the sped teacher who normally at times is like the case manager, unless it's a speech only kid. But you're going to have input on how will they receive the state and local assessment. So will they have their test read to them? Will they get extra time? That kind of thing. Transition planning when appropriate. So we do we are required to start doing that transition. I think it varies by state, but definitely no later than 16, and I think it's 14 at 14 years old. Um, but also we want to do transition planning as soon as possible. And transition planning can be um, building the autonomy in the student to come to their own IEP meetings. And we want to do that as soon as we can. And a lot of times it's encouraging teachers and parents that it is appropriate for them to come and hear about their IEP and be a voice in their own academic planning. I mean, you can begin this as early as elementary school, because you're teaching self-advocacy to the student. But this is really great because this is kind of like a pre-transition planning skill. And then, definitely once we start getting to the high school, we want to start, or maybe even as early as like late eighth grade, we want to start looking at, okay, what are our functional goals? Um, going to start looking like that they're going to carry into adulthood? What is that transition from high school to either a job setting or a college setting going to look like? But it is required that we do that. And then placement justifications in the least restrictive environment. So we always want to choose the least restrictive environment. Um, this means that it's like the least restrictive for how challenging of a setting they can be in while still being successful. Because research shows that when they're in their least restrictive environment, meaning maybe they really struggle in gen ed, but they can do it. They can do it. They'll struggle, but they can do it. Then they need to be in gen ed. Because if we kind of simplify things for them and maybe put them into like a VE class or a unit, we are actually slowing down their growth. So it is our duty to offer students their best possible likelihood of good outcomes, which research says comes from being in the least restrictive environment. Okay, and then we are going to look at appropriate intervention goals at the elementary school level. So this is now kind of where we're talking about like what are we going to target in intervention. This will be, it needs to be curriculum relevant. We need to be targeting like language needed for reading and writing, vocabulary, morphology, because that's going to help us with literacy skills and reading skills, complex sentences, complex syntax, again, helping with the comprehension, narrative skills. That's both good for literacy and communication, expository writing, all those academic skills. They need to be able to tell a story, and that can be targeted very young. That can be targeted from the preschool level, where they talk about beginning, middle, and end. Um, what are the characters, what's the problem of the story. But when you really target these basic elements of a narrative, first then next, then they kind of understand these concepts, so when they're hearing a story and trying to comprehend, they actually can follow along more easily, meaning their comprehension's better. And when they start speaking like that, now we're practicing speaking in an organized manner. And then this will later carry on into reading comprehension. And then we want the meta-linguistic skills, awareness of sentence structures, word parts, thinking about like word meaning, trying to maybe use our own problem solving skills to try to come up with a definition for an unfamiliar word. Um, and those are kind of like things that we would kind of target in language. And then we want to make sure goals are measurable and directly linked to improving access to curriculum and participation in school activities. So remember, I said in a previous lecture, yes, academic, of course, but also social, right? So here it is again. Goals are measurable and directly linked to improving access to curriculum and participation in school activities. So, participation in classroom learning activities, but also social activities, and specials during the school play. Can they interact with peers successfully? Do they need the vocabulary and comprehension to be able to follow instructions for like a school sport? All of that is a consideration. And then intervention activities we kind of already talked about this. I'll touch on a few. We just talked about it, but it's saying intervention activities at the elementary school level. So again, curriculum-based tasks. We want the targets to be meaningful. We want them to be able to access um, the curriculum assignments like classroom texts or assignments, vocabulary instruction, and word learning strategies, because word deficits is a big part of language disorders. And a lot of time they can have very shallow understanding of words. So where like a typical child might have multiple meanings of the word run. Like, oh, I ran into that person at the store, or I go for a run, or there's a run of cards, right? A kid with a language disorder might only understand run to mean running. So when they encounter that word in, in homework assignments or in reading, they're not going to get the depth of the meaning. They might be confused. So we are going to target, specific vocabulary instructions, and word learning strategies. Like, I don't know what this word means. How can I look at the sentence to try to problem solve to figure out what the word means? Um, then we want the narrative construction and the comprehension practice. We already talked about that. We want to work on like sentence combining, syntax manipulation, trying to form different types of sentences, because a lot of times they might have very basic sentences as well. And I mean, we're going to have grammar errors, but even when they're accurate, they're pretty basic. We want to kind of like expand that sentence skill. We want to work on pragmatics, like conversation, peer interaction, and social scripts. Um, so it's interesting because kids with language disorders will a lot of times have pragmatic issues as well. Um, Now, I think, like I said in a different lecture, like the why of the pragmatic issues might be different from one of our kids with autism or social communication disorder. But they're still there, right? So the why is different. The why is like for autism, it might be um, I struggle to use my social brain, or I even though I want friends, I don't understand why these social norms are important, so I'm not going to do them because they don't seem relevant. For our social communication deficits, that is kind of social communication disorder. That is more that like it's a language disorder specifically on the social components. For our language kids, it's more like they're missing so much because of their linguistic challenges. So they might actually have really good friendships and really meaningful friendships, but their pragmatics are impeded and impaired. Their back and forth conversation, the quality of their peer interactions, maybe even their kind of go-to phrases in a social situation, they're impaired, but they're impaired because of the language challenges, not because of their social brain. Like their social brain is fine. And a lot of times you might see these same kids having like really good friends that know they just kind of subliminally know that their friend, has a hard time kind of getting his words out, but he's really fun to play football with, you know? Um, so we're also going to work on literacy focused tasks. This is huge. We need literacy for all of our population. It is a huge barrier to entry for income and adult well-being. And our language kids are going to have problems with literacy, so it's really important. So this is where you're going to see us kind of working on those like phonological awareness activities. It's going to help us with our literacy skills like rhyming, word blending, word building, reading comprehension strategies, maybe giving them little ways they can like highlight sections while they're reading, or like circle important words to like help kind of fortify their comprehension. And then again, yet again, we're going to keep hearing this, collaborate with the teacher. Collaborative classroom instruction with the teachers, maybe even push in, maybe even sit with a child during their ELA section, or maybe even do a little lesson, during ELA for the whole group. Teachers, most of the time, teachers like that. They like, your assistance, your help. It gives them a chance to kind of sit back. I mean, that is definitely very like personality based on the teacher, but that can be really big. And it can also give the teacher ideas too, if you can kind of like model a lesson. And then again, we have our MTSS supports in this chapter, but we already talked about that. So, but I'll kind of come back to it. So previously I talked about primary, secondary, tertiary. This is using that kind of tier one universal level of support, providing the whole classroom strategies. Tier two, targeted small group interventions to deliver short term. Now remember, A lot of times these kids are not in special ed yet. They do not have an IP. Even if you're only speech only, you need that special ed paperwork, right? So you might come in and do 2 or 3 sessions, small group in the back of the classroom, just to kind of like see how these kids are doing. Maybe it's a school-wide program where you kind of visit, the different grades and have your couple little kids just do a little kind of booster session, um, for the students who are at risk. Okay. And then we want to see how they respond to intervention. Maybe that's all they need. Maybe they literally sometimes kids get better just with that. They just needed a little help. But then a lot of times we try that and they're still struggling, and that's a tell that this kid does in fact need that intensive individualized treatment. This is when they're gonna, get their specialized data-driven therapy, their evaluations. But it's good to just kind of test it out, because we also, if it's somebody who can, tier two, can just benefit from just a little bit of booster session, a little bit of additional help. We learn that about the child. We give that information to the teacher. Now the child's staying in the classroom the whole day. He's not leaving his classroom for SLP sessions that he doesn't need, which is good, because this child, if all he needs is a little extra help, then we don't want him missing class time. We want him to be in the classroom, and then the teacher can just do small group with them. But if that is not enough, that is when we move to tier three or special ed support. Roles of various intervention agents and collaboration at the elementary school level. So this is when intervention agents like SLPs can work with teachers, paraprofessionals, reading specialists, behavior specialists. Like I said, my little stuttering friend, he had some pretty severe behavior problems. So, and that impeded his ability to go into a group session with the other SLP kids. So sometimes we need that, and a lot of times with our kids with language disorders or articulation or both, when they can't express themselves, we start seeing that behavior is communication component, where they use challenging behavior instead of their words, because words are hard. So you can definitely pair with behavior specialists, and they can also give you some really good suggestions for like ABA principles in speech therapy. Like every time they say the right word, give them a sticker. Every time they say the right word, they're kind of using that kind of behavior training approach to therapy. They might help to give you some really good ideas. And then we want to pair with the caregiver. So we can do um, how we deliver our services, how we collaborate. We can do co-teaching. We can do classroom-based intervention. We can consult. We can share strategies. Maybe even be that SLP who kind of starts a little initiative, like monthly SLP suggestions, like for the classroom, or pair with the other related service people like OTPT, SLP. And like, we just want to host this little 15-minute lunch chat on things you might want to try in the classroom. Or just, get with the PT or get with the OT and just strategy share between the two of you. There's a lot of crossover there. Um, Reading specialist. Can't believe I forgot the reading specialist. Join up with the reading specialist, share strategies with them, tell them what you're working on in SLP. They can tell you what you're working on in reading. You guys can have a little bit of a crossover, get a lot of bang for your buck that way too. Joint planning and lessons on accommodation. Joint planning of lessons or accommodation. So this is when you want to get with that teacher and you want to do joint planning for lessons, or what accommodations do they need in the classroom, especially if maybe they're a speech only kid or a language only kid, and you're the case manager. So you're going to want to get with the teacher to see what accommodations they need. And then shared progress monitoring and communication across team members. And lastly, application to students with autism and intellectual disabilities. So these are going to be our friends who are very, and again, I think in this context, the textbook is talking more about like severe levels of autism, like kind of that level three, um, where we're going to function more on that functional communication, being able to read signs, being able to identify visuals in the environment on the wall. helping giving teachers visual supports, structured routines, using different communication systems like an AAC device or even just like a paper-based core board. We want to embed communication opportunities in the classroom activities. We want it to be a high participation level of language opportunities, where the kid can actually use language. They're not just sitting and listening the whole time. They're probably not getting much of it anyways if that's what we're doing in the classroom, right? So we want it to be a little bit of teach, a little bit of give them a chance to respond, a little bit of teach, a little bit of give them the chance to respond, because otherwise nothing, it's not going to go in. Supporting play peer interactions and pragmatics is huge. And this one is for all of our kids. And this one is even for kind of our level one high functioning. I know we're not supposed to use the term high functioning anymore, but like our linguistically, academically higher level one autism kids. But we want to support play. We want to support peer interactions, and we want to support pragmatics because if they're doing well academically and they don't sound like they have a language disorder, and maybe they have no articulation errors, there's a very high likelihood that they're still going to have problems in these areas. And these areas are going to, in fact, impact long term friendships, higher ability as an adult, for employment, staying employed, not making your boss mad at you, getting fired. So these are things that can just fall through the crack if they're are kind of like mild mannered, they sound like they're fine kids, but you're going to have severe outcomes later on in life. So we never want to forget these play, peer interaction, and pragmatic elements. Building foundational language skills across a curriculum access. So just making sure that they have the academic language that they need to be successful across reading, science, social studies, math, word problems. This is why we start seeing kids have maybe start seeing kids being identified with language disorders in third and fourth grade because now all of a sudden they're failing math because in third and fourth grade that's when word problems come up, and you start seeing that slide of academic skills. Reading comprehension expectations are getting more challenging. So that's where we're kind of building those foundational language skills across curriculum access. And then close collaboration with the teachers and special educators for tailored support. We've talked about that a lot. Okay. Ooh, we're going a little long. I'm going to keep going though. Chapter 14. um, okay, yeah, I'll do the summary. Okay. So, state a rationale for providing intervention and support for language communication skills in secondary students. That's the first point, first objective of the chapter. We are going to list appropriate products of intervention at the secondary school stage. We are going to describe a range of intervention methods for working with students at the advanced language stage. Describe connections among oral language, literacy, and learning at the secondary level. Discuss appropriate context for intervention at the secondary school level. Discuss process of transition planning for students over the age of 14. We talked about that, transition planning. List appropriate goals and procedures for secondary age students with severe communication challenges. These are probably our special needs kids. And describe modifications to the environment that may enhance communication success for students at the secondary school level. That one you might get a little pushback from your high school teachers, but we can kind of get to that. And for the sake of time, I probably won't dive into things we've already talked about. I might just say this also applies to high schoolers. Okay, so intervention supports student academic, okay, so intervention supports students' academic success, social participation, and future independence. That's kind of for the secondary level we're talking about. Language demands increase sharply at the secondary school level. So this is where we're going to see, man, if we have not targeted those literacy skills and comprehension skills, elementary and middle school, and really, man, like if we're dealing with literacy at high school and we did not get it in middle school, we're really gonna be struggling. We gotta get it in elementary, and we can't drop kids in middle school because by the time they're in high school, like things are gonna be tough. So we're reading more complex tasks. We're reading more complex texts, abstract concepts, higher expectation of organization. This is kind of like our college courses. Like, okay, here's your paper, go figure it out, right? So if they have no reading comprehension, they have struggle breaking down a task. They're going to really struggle, right? Um, higher expectation of organization, writing, self advocacy. This is why we want to get those kids in those IEP meetings as soon as possible, because they're going to need it, you know? And, developmental language disorder, the one that we kind of talked about that's in the DSM 5, that does not go away. That's a lifelong brain difference, right? So we're going to give them skills and we're going to bolster it and we're going to give them coping strategies, but they might have to advocate for themselves in academic and workplace settings, saying, I need a quiet room. I need additional time. I will get it done and it will be done well, but I'm going to need 3 days to instead of one, you know? So that kind of thing, how just communicating their needs so that people aren't surprised. Um, and then at the college level, um, kids with, challenges and disabilities go to college. But the problem is we no longer have an IEP in college and parents can't help in college. So we need to teach us self-advocacy skills so they can go and tell the professor, I will do the work, but I need extra time, right? Or maybe we coach, like, we'll kind of teach them how to find resources in the community, like in the college setting there is normally an office of disabilities. So they might have to pair up with that office. Just self advocacy is a lifelong skill. So we want to be working on that. We're doing all this so that students with language disorders um, can get the targeted support to access the curriculum and prepare for post secondary life, whether that be going to college, going to community college, trade school, or work. So that's the rationale for why we're doing interventions at the secondary school level. The next one is appropriate products of intervention at the secondary stage. We want to improve um, functional communication at the very least in academic and social settings. So that's just those the day-to-day life. Like I need to be able to read the label of the food at the grocery store, read the ingredients, like read the bus schedule, functional, like I can get by in my day-to-day life. But we want, maybe enhanced literacy and academic language, whether it be for employment, college, or even being able to self-advocate at the doctor. There's a lot of reading material at the doctor that you just kind of have to be able to interpret and read and take in. Um, stronger, we want to work on stronger cognitive skills and metalinguistic skills. So, like, we're working on kind of planning, monitoring, organizing. How can we break down written information so that we can understand it? Note taking, just giving them those survival skills. Because now we're in high school. Now we're like, we've gotten where we can get, and now we need to just give you your toolbox. We need to build your toolbox because you're going to graduate from high school one day and you need a toolbox. Okay. And self advocacy, the ability to use supports independently, to ask for help, to advocate for your needs, to tell people what your strengths are, but I'm going to need a little extra patience in this category. Normally, when you lay it out for people, 9 times out of 10, they're fine. They just need to know what to expect, right? Like employers and stuff. And then prepare for transition to employment, higher education, and community living. Um, there's a range of intervention methods for advanced language learners. Strategy instruction, we're talking about using strategies, building their toolbox, building their study skills, organizational skills, comprehension strategies, curriculum based interventions, using real classroom materials, and showing how these strategies can be applied to this type of assignment for this class, this type of assignment for this class. Have them bring in their homework, talk through it, break it down. Don't necessarily do the assignment, but show them how they would do the assignment using their strategies and see if their takeaway from that assignment matches what the teacher was actually asking them to do. We want explicit teaching of vocabulary, morphology, and syntax. And again, at this point, we're in the secondary level. So this is going to need to be really course specific, life specific. We're kind of providing them that little extra support, kind of just to get them through their academic career. Again, collaborative classroom teaching, always a good thing. Peer mediated and group work. This is great because not only is it helpful, but it's also an advocacy skill. If we can teach them how to pair up with friends and ask for help and just say, do you mind if I sit with you? Sometimes I need help kind of just comprehending instructions. That is a lifelong skill. That is something that people are more than willing to do in the adult setting as well. Okay. And that helps to support pragmatic skills and social language skills. So we're kind of doing killing two birds with one stone. And technology supports using agendas, using graphic organizers, using digital tools, teaching them how to use their phone, identify assistive little tricks on your phone to kind of get them throughout the day, enable voice to text if they have trouble writing. There's a lot out there, especially on phones today. Computers, you can you can set your Word docs to be read aloud on Microsoft Word. So these are all these technology supports that they can use. They don't need to constantly be overtaxing their brain if they have a language disorder. There are things that they can use to help make their life easier. Assistive technology. Um, okay, we'll do connections among oral language, learning, and literacy. Um, this is kind of a bigger topic, but it's just, oral language forms the foundation for understanding academic content, reading, comprehension, writing, and classroom learning. So if we have weakness in vocabulary, syntax, narrative structure, pragmatics, it can hinder our comprehension, especially at kind of at the secondary level or beyond, where we're like I'm doing, you know, um, I'm providing an oral explanation of these topics, right? So we need to kind of work on this kind of comprehension of oral language, and then teach skills like note taking, debriefing. Did you understand what was said? Having discussions, talking among the peers, sharing notes. What was your takeaway? What was my takeaway? Did I miss something? And then doing the written assignments. So we learned, we heard, and now can we take it from our head, synthesize it, and put it onto paper? Um, and then improving oral language improves overall learning and literacy performance. Appropriate context for secondary level intervention. So this, I mean, they're saying in the general education classroom through collaboration and push-in, realistically, that's not really going to happen at the high school level unless the student is in like a unit, a specialized unit or classroom. High school teachers tend to operate almost like college teachers in that they really don't, they legally should be interactive participants in the IEP process. But in the realistic, how that looks in reality, it's not a very common thing. So, yeah, that general education classroom, take it with a grain of salt, do it if you can. But that's probably very, really rare. You're going to be more likely, and also those high schoolers do not want you in their classroom. You're lucky if they will come to your therapy classroom at the high school level because they're done. They don't want to be set apart and be different. But with that being said, you're more likely to have them come and do pull out therapy with you than you pushing in. Small group, that's fine. That's kind of same as pull out with small group. And then, with our more kind of like intensive kids, we're going to work on those vocational job setting, community setting activities for functional communication practice. And then we might have like an online format um, that just kind of is, it helps with, relevance to academic tasks, life tasks, maybe kind of check-ins. I think that one's pretty rare in the school-based setting as well, though. I think it's more so going to be the pull out and the group sessions. Um, Transition supports for over the age of 14. We already talked about this, but it's required. We have to do it. So transition planning involves identifying the student's strengths, interests, goals, and needs for support for adult life. And then the team creates a transition plan that addresses education or training goals. We're going to address employment skills, employment interests. What skills do they need for these employment skills and interests, and how can we target that in therapy? Independent living needs, if appropriate, if the kids are like a little bit more of our special needs, severe kids. The SLP can help to contribute to supporting self-advocacy, community skills for the workplace and the community, ensuring language demands of post-school goals are considered. So this could either be post-school work goals or maybe preparing our kids that are bright but just have some language demand deficits to how to seek out assistance on the university setting, how to advocate without mom, how to write an email to your teacher expressing your needs. And but I think really at that college setting they need to teach them to go to the office of development, the office of disabilities, because a lot of times professors, depending on who they are, they might not take it in that they need something different from the rest of the students, but if they're paired with the office of disabilities they will. um, so goals and procedures for students with severe communication challenges. Again, we've already talked about this, but that's that functional communication for daily living skills. We're going to be using AAC assessment and implementation. And once we give them that device or that alternative method of communication, it needs to be practiced. It needs to be used with all the adults in their environment. The child needs to be using it. Student needs to be using it all day long because we've decided this is how they communicate. This is their voice now. And we might need to do that with some kids. Teaching core vocabularies. This is, just kind of like our standard survival vocabulary. A lot of times, like for severe kids, that might be like pictures on a sheet, but at least they can kind of use visuals and pictures to get their needs met. You can use it to request, to reject. You can use it for social routines. But it gives them a way to communicate, rather than just be a passive participant, especially with our severe kind of like minimally verbal students. Participation in academic and vocational activities at the appropriate level. So this could be for our severe kids all the way up to our kids that are more typical kids, but they just have maybe the ongoing language challenges. Training communication partners such as teachers, peers, and family. Maybe even doing community outreach, community education, local, like after school groups, or local employers known to take on like high school students. Maybe just pop in and kind of give them a little instruction. I mean, again, that's kind of, I know that's probably more of like a nice to have if you're a school-based SLP, but if it's something you're passionate about, go for it. It's needed. And we want goals that emphasize independence and meaningful interaction rather than grade level academic skills. And last but not least, we're almost there, guys. Environmental modifications to enhance communication. So again, visual supports. Anytime you have a visual. So for severe kids, this might be, visual schedules, graphic, picture speech. But for higher kids, it could be using a schedule, using organizers, using the phone, and then, maybe asking the teacher to provide written instructions as opposed to just oral. Um, we want to, for some of our students, we want to ask the teachers to provide instruction and directions in simplified and clarified language. Just say like, I know I'm asking you to do something extra, but like this student, if you could just, repeat the instruction 2 or 3 times, he'll be more likely to understand what you're asking him to do if you just say it once. Um, Accessible classroom layouts and reduce background noise. Move the student to the front of the class. Have them sit in the front, have them sit near the teacher. And then, reducing background noise, depending on what the school setting is like, you may or may not be able to do that, but it's definitely a consideration. Um, for more severe kids, we want to consider using assistive technology and AAC devices. Again, probably for our more moderate to severe kids, we want structured routine that helps with language comprehension and understanding of expectations. And we want to provide communication friendly materials, um, such as note taking supports, digital tools, That's that kind of like text to speech. Like maybe the person has trouble writing, where we all text message all day long. Teach them how to do text to speech. These adjustments can reduce communication load and support student success. So that was a lot. That was a really long lecture, but it's a really good overview. Each one of these topics can be dived down much, much deeper. But this does give you an intervention or give you a good overview of what it looks like to support and provide interventions for those language challenges in the school-based setting and helping to prepare the students for the real world. So I know it was a lot of information. I know I was talking really fast. We had a lot of information to cover, but hopefully use this as a supplement in combination with your assignments and your reading to just give a little bit more context to what you guys are learning. All right. And then I'll see you at the next mini lecture. All right. You got this.